Good morning, everyone. Thanks for joining us today. I hope everyone's week is going well. We're together today until 1 p.m. And we're going to explore moving from awareness to action on workplace mental health. And we're joined by the wonderful Alexa Knight from the Mental Health Foundation. Morning, Alexa.
Hello there.
Just before I introduce Alexa properly, a couple of quick housekeeping notes from me. Zoom has got a Q&A button down the bottom of your screens, so feel free, please, to pop any questions that come up into there as we go through. And I'll make sure we've got some time at the end before we finish to answer as many of those questions as we can with Alexa. There's also a chat box as well. Again, feel free to pop comments, share your thoughts in there as well. I will do my very best to keep an eye on all these things, but I am a bit rubbish at multitasking. Also, following the webinar today, an email is going to be sent out to everybody probably tomorrow with the recording and some resources from Alexa as well. Any questions we don't get to today, we'll do our very best to answer in the follow-up email tomorrow. So, if we're all sitting comfortably, I would like to introduce Alexa. So, Alexa has worked in health policy and advocacy for around 25 years and leads the Mental Health Foundation's media campaigning, policy and public affairs activity across the UK. Before joining the foundation, Alexa led the policy and practice teams at Rethink Mental Illness. Before that, she spent many years in policy and public affairs consultancy working with health clients from life sciences, charity, service provider sectors. Alexa's previously led the government affairs teams at the Healthcare Commission and also at the Royal College of Nursing. The Mental Health Foundation is the only UK charity solely focused on preventing poor mental health and protecting good mental health. The Mental Health Foundation work across 4 nations in the UK with offices in Belfast, Cardiff, Glasgow and London. The Mental Health Foundation are challenging the way things are done and creating fundamental change in the UK's approach to mental health. And they do this in a number of different ways by researching and developing new, more effective ways to support good mental health, providing everybody with evidence-backed advice and resources they can trust, running national campaigns and working with local communities to support and nurture good mental health, and working with organisations across the UK, influencing decision makers at all levels to take the valuable lessons that we've learned and adopt solutions that are proven to work, which is going to be really important for our conversation today. So, morning, Alexa. First of all, I'd just like to say an absolutely massive thank you for giving us not just your time this morning, but also your knowledge and wisdom as well. No pressure. So, moving from awareness to action on workplace mental health. Let's start by sort of establishing why mental health at work is such an important topic. What are your thoughts around this, Alexa?
Thanks, Mark, and thanks for having me this morning. It's such an important topic. I think mental health is really built in communities, and for most of us, we spend the majority of our adult lives working. So the workplace is often our most important community. And being in good employment, having a good relationship with our employer, that's really important for our mental health. And it can be a really positive, protective factor in building good mental health. But conversely, we know that poor work, stressful work, or being out of work can have a really negative impact on our mental health. It can affect our sense of identity and purpose, and that leads to a really vicious cycle of being out of work that can be really hard to escape from. So as a society, we need to really move to a model that is focused much more on preventing poor mental health at work, rather than waiting to treat it when it does arise. And creating mentally healthier workplaces doesn't only prevent poor mental health from rising in the first place, but it also allows people who have been out of work to return to the workplace with less risk of becoming unwell again. But ultimately, unemployment is one of a range of factors that affect our mental health. And we have recently surveyed a range of experts in mental health, doing something what's called a Delphi process to talk to them about what they think are the most important social determinants that affect people's mental health. And they came up with 6, which is really interesting. Mental health and employment is one of the main ones, interestingly, but there are others that are linked to employment, which also came up. So things like financial insecurity and social connection, also really important and really relevant to our discussion today. So I think it's such a timely conversation. And, lots of us will have seen the report out from Charlie Mayfield this morning that was commissioned by the government on how we can do better on making the workplace a healthy place for people. So we could come on to talk a bit about that later as well, perhaps.
Brilliant. Thank you, Alexa. Cheers. Do you have any sort of statistics or any sort of trends around mental health that can help sort of throw a bit of light on where we are as a nation with this at the moment?
Yeah, I mean, it's not great, to be honest. We are facing a bit of a mental health crisis, I think it's true to say. And that's borne out by the government's own statistics, particularly on mental health. There's a big national report, which has got the unwieldy title of the Survey of National Morbidity and Mortality Review, which does sort of back up the theories that many of us are feeling that people's mental health is generally worse. And on top of mental health, we're not great generally at being well and being in the workplace. So 1 in 5 working age adults is now out of the labour force. And that's 800,000 more than there were in 2019. And that's all due to health reasons. And I think traditionally or historically, a lot of that has focused on musculoskeletal conditions. And that's still, one of the major factors keeping people out of employment. But actually, mental health and stress are increasingly common as reasons not to be working as well. And that is particularly true for young people. So young adults, the growth in 16 to 34-year-olds with a mental health condition who are economically inactive due to long-term sickness has risen by 76% between 2019 and 2024. So there's an awful lot to be done. And of course, as well as the human cost, there's also an economic cost to that. That's about 7% of GDP is the government now estimates as the cost of poor health at work. So it's a massive concern.
Wow. Okay. Yeah. I mean, I knew obviously that it wasn't great, but those figures are depressing.
Yeah, they are depressing. They are depressing. And there's lots of reasons, that we can speculate or that we might know about that have contributed to that poor mental health. I mean, obviously there's the pandemic that people talk to still, and that has, had long-reaching impact. But even before the pandemic, there was a long period of austerity that has impacted and continues to impact people's quality of life. On top of that, particularly when you think about young people, obviously there's the impact of social media. There are cuts in sort of community outreach and services that are available for people. I think increasingly as well, there's the impact of, what's happening in the world globally and what people are seeing and interacting with every day in a really graphic way, which, young people haven't been in that position before. So there's all sorts of things that have contributed to where we are. I think looking for the hope and the optimism, is a lot of this is preventable. There's lots of things that we can do and should do to make things better. And I think when we think about employment as well, employers are in such a brilliant position to help and support people, both to help people keep safe and well in the first place, but also to help them get back into a good place once they have faced their struggles.
Yeah, thanks. We're in the month of November, and as it's sort of officially Men's Mental Health Month, I suppose I'd be remiss if I didn't ask if there's any sort of specific thoughts or data or trends around sort of the men's mental health in the workplace.
Yeah, I mean, men's mental health generally is really, really interesting. There are the continuing awful statistics around men who take their own lives, which is, the sort of ultimate failure of prevention of mental illness. And, over 74% of suicides are still men, and it tends to be men in midlife, sort of age 50 to 54. And many of those people have not been in contact with mental health services before. So I think that sort of bears out the idea of men suffering in silence, if you like, not coming forward, not talking to people, not reaching out. And when we think about men in the workplace, I think that is even more so. I think there's something about the societal expectation about men being economically active, about being a breadwinner, that's still very much there. And that can be really, really difficult if, as a man, you are struggling at work or you're finding things difficult, or if you're out of work. I think men disproportionately can feel a sense of shame when it comes to their mental health at work. Um, and this sort of cultural backdrop really combines, again, in a vicious circle to stop men coming forward at work. So we know from the Men's Health Forum that over half of men feel that they would be concerned about taking time off work for their mental health. And almost half would be embarrassed or ashamed to tell their employer that they're having mental health problems, um, which is hugely significant, because actually reaching out, getting help, taking that first step, that's the most important thing that somebody can do on that path to recovery.
Mm, yeah, absolutely, absolutely. And on that sort of note, I mean, I guess we're living in an age now where lack of awareness, if you like, is probably not so much of an excuse as it was previously. Awareness around mental health is arguably much more prevalent. But what's holding organisations back from sort of acting on that awareness, if you like, turning that awareness around mental health into meaningful actions? What are the sort of common organisational barriers?
Yeah, I mean, I think awareness, greater awareness around mental health is a hugely positive thing. We're big believers in awareness, and I don't think we are job done on that by any means. Because although we've come a huge way in how we think and we talk about mental health, we know that people individually still find it really difficult to talk about their own mental health. So there's a lot more that we can do to try and address that stigma and normalize conversations around mental health. But yes, awareness on its own isn't helpful. We also need action, and we need employers to take action. And I think there's a few things that are holding employers back. Some of it is just that we're in a really difficult economic climate. Things are hard for everybody. And so some of the sort of very basic things that can make employment and work good for people's mental health, employers may feel are harder to do. And I'm talking about things like fair pay, work life balance, breaks, time off, all of that sort of thing. But actually, we know that where employers do have those things in place, where they are trying to create mentally healthy workplaces, that actually reaps benefits in terms of retention, reduced sick pay, reduced absence, and all of those things. So although employers may feel under pressure because of the economic situation, we do know that actually investing in good mental health, investing in staff support, does reap economic as well as human benefits. I think as well, the world of work has changed so significantly for everybody over the last period. And I think it's taken a while for people to sort of work out how to adjust and keep up with some of that. So, one of the biggest things that an employer can do to support mental health at work is to invest in line managers and make sure that line managers are well trained in mental health, that they know the signs to look for, that they know how to speak to their colleagues and offer support. But I think that can feel more difficult when people are working remotely or in a hybrid situation, because you might not be having the same interactions with people, or it might be easier to put those interactions on hold until you think you might see somebody in person. But actually, just because somebody's working remotely, it's almost more important to check in with them on a regular basis, because while there's lots of mental health benefits to remote and flexible working, it can also hide some of the distress that people are feeling and make it less obvious to line managers and to employers. So I think people need to think creatively about how they are checking in with colleagues, making sure that they are still protecting those touch points, and encouraging points for people to be able to share openly how they're feeling about things.
I love the fact that you mentioned people managers, line managers training. We have obviously at Neurobox we work an awful lot with organisations and employees around neurodiversity, and
Yeah.
again, a lot of the awareness and the understanding. It doesn't necessarily start with line managers, but it's entirely dependent on line managers. Organisations can have the best mental health policies in the world, but if line managers, team leaders, A, aren't aware of those policies and processes, or B, feel uncomfortable having those conversations in the first place, then it's really all for nothing.
Yeah, absolutely. And training like yours is, it's so important. And one of the things that I was struck by just looking through the report that's out this morning, which was commissioned by government and led by Charlie Mayfield, who I think was chairman of John Lewis, is he said he found a real culture of fear about talking about mental health issues, about talking about disability and neurodiversity, from line managers with their staff. They didn't want to say the wrong thing, they didn't want to
Mm,
do the wrong thing, and that often led to them not saying anything. And equally, when people were having periods off work, they were often just left because line managers were scared about reaching out. They didn't want to put pressure onto people. But actually, we know from other countries' best practice that actually having ongoing contact with a workplace, even when you're off sick, can be really helpful in keeping that connection and easing your way back into the workplace. So, yeah, line management training, hugely important.
mm. Okay, absolutely. And of course, line managers themselves as well. So, have you got any advice for sort of specifically supporting people in that type of position where they have not only to be aware of their own mental health, but also their teams?
Yeah, definitely. I mean, I think making space for supervision, being able to talk to somebody in a leadership role about what you're thinking and feeling is really important for line managers as well. And I think some of those things can be put in place structurally, but I think more importantly, it's a cultural piece. It's about leaders of organizations being authentic themselves, making clear when they are struggling or the things that they are grappling with, and normalizing having those sort of check in spaces, those periods for reflection, so that line managers have the space and the time and the expectation to do that themselves.
Mm, yeah, I think you're absolutely right. That's really, really important. And of course, hand in hand with that as well is that not just providing that awareness, but providing the actual time and space to reflect as well. Um, because very often these sorts of conversations aren't normally classed as part of the management role. They're kind of on top of your day job, if you like, looking after your team's well-being and so on.
Yeah, I think that's right. I mean, in my organization at the Mental Health Foundation, as you might expect, we, we take mental health staff really seriously, which is great. But our chief executive, who is a man, is really good at being open and vulnerable about his own mental health, and he will start all of our senior team meetings with a check-in, a well-being check-in, which is really comforting as a senior manager to know that you have that space. Not just that you have it, but that you're expected to use it, that you're expected to share how you're feeling, what's going on for you that day. And I think starting at the top really sets the tone for how managers across the organizations run their meetings, support their teams, and feel able to take the time to do that.
That's really, really interesting. Um, just sort of zooming in on that a little minute, Alexa, in those meetings where your chief execs and so on take that time at the top of the meeting to check in,
Mm.
that's brilliant. What makes people feel safe to be authentic when asked those sorts of questions in that environment? What's the difference between an organisation that sort of nods their head in that direction versus actually genuinely creates an authentic environment where you feel safe?
Yeah, I mean, a lot of it I think comes down to listening and again to action, as we sort of hinted at the beginning. So it's great allowing people the space to open up, but you also have to listen to what they're saying. And if there are things to do with workload, for example, that are impacting on someone's mental health, then you need to action them. So it's that follow-up action, making sure that people's workloads are manageable, that people are coping with work, that they have the training and support they need to do their job without feeling under pressure. All of those things are really important as well. And then, of course, there's the sort of the basics that people should put in, things like employee assistance programs, flexible working. All of those things are really important. So it's not just talking the talk, it's also walking the walk and putting the right things in place for staff. We recently piloted and have now instigated a 32-hour working week, for example, because there's so much evidence out there that having a reduced working week is actually really, really good for people's mental and physical health. And I think, thinking about the barriers to organizations implementing these sorts of things, I know from my own perspective, when we were talking about introducing a 32-hour week at work, I was really worried about it. Not because, I didn't want to support my teams, but I thought, everyone is so busy. Everyone is working so hard. If we reduce their hours, is that going to double the stress that they're under rather than alleviating it? But we implemented it, and we did it as a pilot, as I say, first of all, and we did a really, really rigorous evaluation of it. And we found, I mean, amazingly, like overwhelmingly, it was a success in terms of people's mental health. I think something like 70% of our team said they felt better mentally, physically, and so on. I think what was really interesting was that the biggest improvement in well-being was seen in those groups of staff who are most at risk of poor mental health. So people with a disability, people with neurodivergency, lone parents, those people saw the most benefit, which is great because that so very seldom happens when you introduce a universal benefit. But also in the way that we looked at productivity, we found that people's productivity didn't fall. I mean, productivity is a really hard thing to measure in an organization. So sometimes you have to use proxy measures. But in the way we felt as a senior management team, with the way we were hitting our KPIs, we haven't seen any loss in productivity at all. So I think those kinds of initiatives can feel really, really difficult for organizations to imagine themselves doing. But there's a lot of evidence out there now, and there's a lot of how-to guidance and support. So I think organizations need to be brave, not just in opening up space for employees to talk about their mental health, but actually putting in place concrete initiatives to make that happen.
That's fascinating. Yeah, that's cool. You talked a moment ago about sort of remote working and so on. How how does remote working, distributed teams sort of affect mental health differently to being office based?
Yeah, it's interesting, isn't it? I mean, being remote or hybrid can be, again, really good for people's mental health. I mean, particularly if you have a disability of some kind or you've got caring responsibilities, being at home can just make things easier, even if it's not all the time, even if it's a couple of days a week. But it also comes with risks. So one of the things that we found when a lot of people switched over to remote working during COVID was the always on culture. Very hard to differentiate between work and not work, very hard to turn off. And that can be really difficult for people's mental health. And then the other tricky thing about remote working is that check-in. How can you make sure people are okay? How can you spot the signs if you're not physically seeing them every day? So I think those are the major hurdles to grapple with, and neither of them are, insurmountable. I think a lot of employers and a lot of employees have now sort of got better at trying to delineate the working day. So making sure that you do turn off, and employers can make sure that they're not sending emails out of office hours when people might feel they're under pressure to reply. Um, and equally, if you have a team member who is mostly or entirely working remotely, then making times for those check-ins is even more important, and watching out for the cues, the signs that you can pick up on that perhaps things aren't going well for them.
And what might some of those signs be?
I mean, it's different for different people. So some people might respond, or you might notice that they are not as productive as normal, but some people can actually still be really productive, or they can work more intensely when they're having a tricky time. Um, some people might be quieter. Some people might seem as if they are more moody or less communicative. It is different for everybody. So I think it's a case of getting to know your colleagues and then spotting changes in behaviour, um, as well as, of course, trying to encourage open dialogue and asking the right questions. And I think sometimes opening up those conversations can feel really tricky. So perhaps opening up with an observation, sort of, I've noticed that you were a bit quiet in that meeting, or I've noticed you've missed a couple of deadlines. Is there something going on? Those sorts of things.
Okay, yeah, that makes sense. And it's again, it's one of those questions that comes up quite frequently for us as well around those conversations, and for people managers starting those conversations is really really difficult. It's how do I approach this? How do I start the conversation without making without making the situation worse? Um, so I quite like your suggestion there of I noticed that something's different. Is there anything we can do type of thing, rather than approaching it from a performance point of view, if you like.
Yeah, absolutely. Absolutely. And I think if people have the expectation that the first few minutes of a meeting will be a well-being check-in, that's also helpful. So they will come, perhaps not, ready to open up about everything, but ready to talk about if they are finding something difficult.
Hmm, okay, yeah, I like that. I like that. Um, I've mentioned before that obviously, here at Neurobox we work a lot with people with neurodifferences, neurodiversity in organisations. Mental health is a really common co-occurrence with neurodiversity. In fact, I'd probably go so far as to say that in my experience, it's virtually impossible to be neurodifferent and not have some mental health challenges as well. Do you have any advice for organisations how they might support in those sorts of situations?
Um, I think it's really important for managers to be aware of the fact that people might respond differently for different reasons. So, one way of working might not work for everybody. And to really think about what it is that's going to work for an individual, and to listen when they tell you what it is that works for them and what's going to make their lives easier at work. Um, and I think it's this being flexible, making adjustments as necessary. That's the thing that can really support both neurodifference, but also mental health as a result. So it's that openness, the willingness to listen, the adjusting both a style of interaction, but also creating changes in how people are able to work and engage with work, that's really, really important. And actually that came up quite strongly in the review, the little bit that I've looked at this morning, that actually employers often don't do enough to accommodate different ways of working and different preferences of styles of working. And there's much more that employers could do in that space. And I think one of the recommendations was that there should be a rapid review of what works well in employment for people with neurodiversity as well as for people with mental health problems, which is great. So hopefully there'll be a lot more evidence coming forward as part of that review about what works for people.
Mm. Yeah. And I'm just again reminded of what you said earlier, Alexa, around it's about noticing differences from how
Mm,
someone would normally work. And I
mm.
think that's really important because, again, we talk about sort of neurodiversity, disability, diversity in general, but actually, they're all just different ways of being. And as a people manager, if you get to know your team, what's important is that you recognize how people work best, how you can support that, and then when things change and become different. And for that, I think the most important thing is people feeling safe being able to share that they may need some support at some point. So it's creating that environment of safety, if you like. Um, and you mentioned a couple of things around sort of making it a part of everyday conversation. I'm going to ask about your mental health as part of our normal interactions. It's what we care about and what we do at this organization. Are there other things that you can sort of suggest or think of that organizations might do to sort of normalize, if you like, the discussions around mental health?
Yeah, exactly. And I think it's about having an open mindset about what normal practice is. So, you mentioned about asking somebody about their mental health, but actually asking people what their preferred way of talking to their manager is. Is it in a face-to-face
Mm,
meeting? Is it something with a regular schedule and a regular agenda so they know what's coming up? Is it something else? And allow people to advocate for themselves and their preferred way of working and try and be as flexible as you can. And I think there's been a real shift in employers moving from, we have one rigid way of doing things and everybody's going to do it the same way, to actually realizing that people aren't being difficult if they suggest a different way of doing things. They're just trying to find the best way where they can be the most productive and the most helpful in the workplace. So I think some of that's about mindset and some of it is about asking those questions. What works for you? What can I do to support you in this situation? And then acting on that.
yeah, yeah, absolutely. I like that. Yeah. Are there sort of practical ways that you can suggest for organizations to sort of support people?
Well, yeah, I mean, there's loads of things that employers can and should definitely do. So some of those getting the basics right, the fundamentals of work, the fair pay,
Mm,
giving people a sense of control, valuing people in their day-to-day work. But then there's, the more exciting initiatives. So as I talked about our 32-hour week, I
mm,
think part of that one of the things within that was important to us was also being flexible within that week. So for some people, for example, I take every other Friday off. That's how I work mine. But other people work a shorter day. Either they start later and they spend that morning time, dealing with their mental health or doing exercise or taking their kids to school, or they might finish earlier on particular days where they have different responsibilities. So if you can, then creating that sort of flexibility and autonomy around the working day is really, really important. Um, but other things include like a risk assessment that employers can do about what are the psychological triggers in our particular workplace, what periods of the year or the month might be very stressful because we have got deadlines that people need to adhere to, and how can we mitigate against that. Um, Investing in line managers, we've talked about, but we probably can't talk about enough because I think, so many people end up in line management almost by default. If you
yeah.
want to progress through an organization, you will often end up line managing people, even if you're not particularly
Good at line
naturally
managing people.
yeah.
Very often, in my experience, certainly people get promoted to management positions because they're good at the job that they do. So the
Yeah,
assumption is you'll help everybody else be good at their job, but it isn't quite that
exactly.
simple.
Yeah. And it's a skill that people need support to learn. So, continuing to invest in line managers and continuing to check in with line managers. And I think another thing, a practical thing that can help with that is 360 feedback, both for individuals, but also for line managers. I think I've been a line manager for many years now, but I'm always learning new things about the impact that I have on people inadvertently. I spent ages not realizing that I rarely smile during meetings because I've got resting sad face.
Resting sad face.
I was giving people the impression that I was really cross with them all the time. So now I had to make a special efforts not to look quite so cross.
Oh,
So yeah, there's lots of those sorts of practical things that employees can do. I think as well, things like staff networks, so encouraging peer support at work, you know, whether that's the parents network or an LGBTQ plus network, all of those things can be really helpful. Peer support, finding your friends at work, for once, you know, for want of a better word, we tend not to talk about work and friendship, but they say work is our biggest community, and there's so much joy that can be found there. So I think peer support networks at work are super helpful, and they can also, as well as sort of supporting individuals, they can also be a really useful mechanism for surfacing when there's structural issues at work that actually are causing a problem for one or other particular demographics of people as well. And then there's sort of ongoing things like staff surveys, which aren't always comfortable for organizations, but can really help to yield important information about how employers and staff are feeling about work and what's going on and how we can improve things for different groups of people.
Yeah, that sort of leads me nicely on to my next question, really, Alexa. I was going to be asking you about how can organisations measure how well they're doing around supporting mental health. You mentioned surveys,
Yeah.
other sorts of metrics or things that we can be looking at?
Yeah, I mean, there's a sort of broad metrics, things like sickness absence data, which most organizations collect. Although obviously you need to make sure that that's being completed properly in order to make sure it's a useful measurement. And I think sometimes, you know, sometimes line managers, either they feel too busy to report sickness absence, or sometimes they feel they are, you know, exposing their colleagues by recording how often they're off sick. But actually, it's really important to know when people are off sick, because that's, you know, that can be a sign of something structural in the organization. And you can't change that thing, and you can't offer support to individuals if you don't know that they are struggling in the first place. Staff turnover, really important to track. How long are people in particular posts? Are there people in particular areas of an organisation where staff turnover is particularly high? And why is that, if so? Exit interviews can be really useful, as long as they're acted on. And things like deep dives into particular groups. So, you know, what are the most junior members of our team feeling at the moment? How are our working parents feeling? What's going on for different parts of the organisation? I think that having that ongoing dialogue with staff is really, really helpful.
Yeah, I love that. Just keeping an eye on the time. Have you got a story or an example, perhaps, of where you've seen one workplace get it right? Anything you can think of?
Um, I think where you see real change in an organisation, that's the thing to point to, isn't it? Where you can see um, actually something in this organisation has changed. And I'm gonna talk about ourselves again. I'm sorry, just to go on about Mental Health Foundation. But you know, we're a charity, so there's lots of things that we find difficult to do for our employees. You know, I've worked in the private sector before, where it's quite easy to give people a pay rise or offer them a bonus if they have done something great. But you can't do that as a charity, because you don't have the resources and you have to spend it in a circumspect way. But so we try and do the things we can. And obviously the 32-hour week was our massive thing that we did recently. But we have really seen that bear fruit for us, not only in terms of the things I talked about earlier and the impact on people's well-being and mental health, but actually in terms of retention and recruitment. So it's a really competitive environment, recruiting people into the charity sector. And we found that over half of people applying for jobs with us have mentioned our 32-hour week as one of the things that attracted them to us, which is extraordinary, really. And I was quite surprised that people were were saying that on their job applications. And I think it's great. I think it's really, really good. And, you know, we're not a perfect employer by any means, but we try to listen and we try and change when our staff tell us things aren't working right.
Mm, okay, no, I love that. That's brilliant. Earlier on, you mentioned the Charlie Mayfield report that came out today. I just wondered if it would be worth just briefly sort of explaining what the Charlie Mayfield report is, and I don't know if you've had a chance to look at it yet or not, but if you have any thoughts around it.
Yeah, I've had a look at it. I mean, I've had a skimmed look at it, I should say. I think it's really positive. I mean, there's been this ongoing political narrative, I think, that has built up over the last few years about particularly mental health and out of work, which is that somehow people are less resilient, that they are almost making it up, that they need to pull their socks up a bit and just get back to work, and that the benefits bill is unmanageable. And I think that has been really a damaging narrative because we know the evidence shows that generally speaking, people's mental health is worse. People are not making it up. People don't want to be generally out of work. They want to be in work. And that's a good and protective thing for them, as well as good for the economy. So what I really like about this review and what I've seen so far is that it is really positive. It talks about the positive benefits of being in work, and it talks about employers working with staff and with government to try and be more flexible, to try and make it a more positive environment, and to do more to support people being in work. So one of the things it's talking about is, you know, trying to do a bit more of a deep dive, looking at evidence on things like neurodiversity, mental health, disability, and what works for people to be able to be in the workplace. And it'd be great to pull together the evidence on some of those things, because a lot of it, you know, there's a lot more that we could know about those things. It's going to have a sort of 3-year program of employers working to try and become a better workplace for employees, to try and become a safer, psychologically safer, healthier workplace. And it just feels like a much more collegiate approach, government and employers working together with their staff to find out what works to keep people healthy and to get people back into work. So I have to read the detail, but I think there's lots in there that feels different and positive and like a dialogue rather than a stick, which is
Mm,
great.
mm, okay, fascinating. And what is the Charlie Mayfield report, Alexa?
It's called the Keep Britain Working Review, and it was commissioned by government. And I think what the report team has done is they've gone out and they've talked to loads of employers, but they've also talked to a lot of employees and disability groups and mental health groups about what the challenges are. And they've looked at best practice, things like the Dutch model and the Danish model, where there's a lot more contact between the employer and somebody who is off sick, for example. Um, and the report's got loads of recommendations. It's got recommendations for employees and it's got recommendations for governments. And as I say, it's going to go on to be this sort of 3-year pilot. They're calling it a vanguard system where employers can sign up to develop best practice to keep people healthy in the workplace, which sounds great.
Okay, fantastic. And how long has this report sort of been in the making, if you think?
I think it's been about 9 months or something like that. So, you know, that's fairly speedy for a government
Yeah,
report.
it really is. It takes longer than that to get access to work support.
And obviously, you know, there's the economic imperative that sits behind it. The government
Yeah.
wants to get, you know, people working from a productivity perspective. But I think what really comes through in this report is work as an asset and people's good health as an asset. And it's that shift culturally from blaming people for not being able to work to thinking, well, actually, what can we do to make this easier for you? How can we support you in the
Yeah,
workplace? And that's great. That's the approach that we need.
absolutely. And of course, I mean, it shouldn't be a difficult argument to make because
No,
it's a win-win situation, isn't it?
absolutely. Absolutely. Yeah. Yeah. I mean, obviously, this is a sort of semi-independent report, so the proof will be in the pudding, won't it? You know, what gets implemented? How does the government support it? We've all seen very positive initiatives before sort of wither on the vine. But this does feel like it feels like a good moment. It feels, from the conversations that we are having, certainly with parts of government, that they realise they've got to take this seriously, which is good.
That that's good to hear. That's brilliant. That's encouraging. Cool. I'm just looking at the time now, and I promised sort of 15 minutes or so toward the end for sort of to look at people's questions and so on. So please, just if anybody does have any questions, please feel I can't get the words out today. Please feel free to type them into the Q&A box or the chat box. Just looking through at the moment. Um, Camilla, thanks for your question. You mentioned the importance of peer support. What's your perspective on mental health first aiders and how companies can maximise their impact? I found that they're often underutilised. Um,
Mhm.
I've recently undergone mental health first aider training and I found it absolutely fascinating. So yeah, I'm really interested in that question as well. Any thoughts, Alexa?
Yeah, it's a good question. And I think you really hit on it there. It's like how people use it and how it's implemented and kept going on an ongoing basis. That's the important thing, isn't it? It's the same with employee assistance programs. They're no good if they're just there and nobody uses them. I think mental health first aid has some great things about it. I think anything that encourages people to spot and recognize symptoms in their colleagues or to open up about conversations about mental health has huge potential. But yes, it must be an active living thing. It can't be something that's a tick box exercise done and dusted and then everyone forgets about it. So I think with all of these initiatives, it's the ensuring long-term commitments, creating space for that work to happen, reminding people that these services are there. Those are the things that lead to success.
Brilliant. Yeah, I love that. Um, okay. Any other questions? Please, as I said, please feel free to just tap them in. I've actually got a question for you, Alexa. What would you say to a manager who genuinely cares deeply, but also feels a little bit unsure or afraid of saying the wrong thing? What advice would you give to a manager like that?
I mean, generally speaking, it is better to say something than nothing.
Mm,
And there's some guidance on our website and that belong to others about how you can open up those conversations. And I can send a link through later about some of those conversation starters. If you're not sure, then it's worth talking to your HR team and getting their advice ahead of a conversation. Um, but I think opening up, asking questions that allow people to sort of ease into a conversation. So, either as we talked about earlier, the sort of, I've noticed this, what's going on, or even just, how was your weekend? Starting with something that allows people space to talk about something that's not work related, but might feel a slightly more gentle way of approaching things. But I think generally, don't feel that you have to solve everybody's problems straight away. You are
mm,
trying to open up a conversation and to listen. You're not there to be the one with all the answers. Um, you can go away afterwards and you can try and sort things that are work related, or you can signpost somebody to mental health support, but you don't have to be the one with all the answers. So don't let that stand in your way. I think the most important thing is to get people to talk and to open up and then go from there.
yeah, yeah. Do you know what? I think that's really, really good and powerful advice, actually. And very often, as managers, we very often do feel like we are there to solve problems and have all the answers.
Mm,
So actually, being told that no, this might just be the opening conversation in a series of conversations, and using words like be gentle, but not just to the person you're talking to yourself as well.
Yeah.
They're really, really powerful, I think. So yeah, thank you for that. Um, okay, one last question for you, Alexa. One last question. Finish on some positivity and optimism. What's giving you hope right now about the future of mental health at work?
I think that the fact that most workplaces do talk about mental health in and of itself is huge. I think the fact that people are starting to see health and mental health as an asset to be protected rather than an illness to be feared
Mm, okay.
is massive. I think as well, there's something about where we are now with so many people struggling on and off with their mental health, with so many people out of work, that I think there's just that growing realization that we cannot treat our way out of this, that it has to start with prevention, that we have to make sure that we are nurturing good mental health at all levels in organization. And that really, really does give me hope. I mean, we talked earlier in the conversation about men's mental health. And I was chatting with a group of men on a mental health forum the other day, and they were saying, they think slowly and surely there is culture change, that increasingly in some of their WhatsApp groups and some of their friend groups, if someone has gone a bit quiet, increasingly it is common for one of the others to reach out and just say, you're right, pal. I think things like football clubs are playing a much more visible role in naming and drawing attention to these issues. So I feel like although the world is a heavy place and that contributes to us all feeling, anxious about things, I also feel people are much more aware of what can be done and what should be done. And that's great.
I love that. I love that. And I love the way you framed mental health as an asset. And it made me think actually, if you're running a business or an organization,
Mm.
normally when you talk about assets, you would be thinking about tangible things. It might be machinery, it might be vehicles. And we'd never let them run themselves into the ground without regular servicing, would
Exactly.
we?
Exactly. You don't wait for those to break. You make
No.
sure they're regularly serviced and oiled and not exposed to dangerous elements.
Yeah, love that. um, Mark's posed a question, Alexa. So, an increasing number of companies now have mental health first aiders, but don't have any support in place for the mental health of their mental health first aiders. What's your experience or opinion on this?
Yeah, I think that's quite common. People think, again, box tick, job done. We've got this
Mm,
network of people and we've had some training for them, but it can be really hard going. It can be hard going. Having those difficult conversations, holding that space, holding your colleagues. And so those people themselves need supervision and they need peer support, and that has to be in place. We see it with mental health support, we see it with safeguarding, all of those roles where you are carrying the weight of people's emotions and health. That itself needs to be supported and that needs to be built into any scheme. That time needs to be carved out of work. It needs to be normalized that you will have space for these things.
mm, yeah, absolutely. Um, Thanks for this great conversation. I'd like to ask, how can we keep a balance between employers' mental health and productivity or strict deadlines?
Mm.
I think that means in employees' mental health and productivity or strict deadlines.
Yeah, I think people need to be, realistic about what it is that employees are able to do. And that's a two-way dialogue often. I think when an employer or a team sets objectives or goals or targets or work plans or whatever you want to call it in your organization, it's really important for the line manager to have an idea of how long something should take or how difficult something should be. But the person doing the work will also have their own views and may have some more in-depth knowledge about their area. And so the question is to have that ongoing dialogue about how projects are going, if milestones being hit, and if they're not, there's probably a good reason why they're not. What is that reason? How can we mitigate against it? And importantly, how should people prioritize where they've got competing deadlines and competing targets? So, you know, dare I say, it comes back to line managers again and that ongoing check-in, and setting realistic targets and supporting people to stick to them.
Brilliant. Thank you, Alexa. Okay, so I don't think we've got any more questions. It says just checking, and if we have and I missed them, I apologise. So it's now 5:02, so I think that's probably a sensible time to sort of wrap up a little bit. So Alexa, I'd like to thank you. Amazing insights, and thank you for your knowledge. That was a really fascinating conversation. Thank you.
Oh,
Um,
thanks for having me.
no, it's our pleasure. And also, I'd like to thank everybody for taking the time to join us and for your questions as well. As I've said before, we're going to send an email out, I think tomorrow, with everyone who signed up with the recording and some resources and so on. But other than that, I would just like to say thank you again to Alexa, and thank you to everybody, and enjoy the rest of your days. All right.
Bye.
See ya. Bye bye.